Hello everybody, I am Dr. Sanghvi, consultant diabetologist from Mumbai. Today I was speaking at the 50th Golden Jubilee conference of RSSDI, a mega platform of diabetes in India. My topic today was about management and prevention of hypoglycemia in our patients with diabetes. So achieving a good glycemic control, a good value of sugar is always a tightrope between managing hyperglycemia or maintaining good glucose controls, but not allowing the sugars to drop, that is go to hypoglycemia. This tightrope can be managed well by us physicians. So achieving good glycemic control will reduce complications, but when the patient gets too many hypoglycemic episodes, they land up into bigger troubles. They may have cognitive dysfunctions, coma, seizures, or cardiovascular risk. So our aim as treating physicians should be to reduce the glycemic variability, to increase the sugars more in time in range, so that the patient not only experiences good sugars but a good quality of life. Now, when we're talking about managing hypoglycemia, let's understand that if there is a mild hypoglycemia, if the blood sugars start falling, say below 70, and the patient perceives symptoms of hypoglycemia like sweating, dizziness, palpitations, the first thing he has to do is consume sugar. There is a rule of 15 there. Have 15 grams of carbohydrate, recheck your sugars after 15 minutes. If they are still dropping, go to the previous step. If the sugars are going above 70, then you have a snack or a meal what is due at that point of time of the day. If the hypoglycemia is severe, if the patient is unconscious, it may happen that it will need external help. So that time, put the patient in a recovery position and secure an IV line. Start giving a 50 to 100 ml of 25 to 50% dextrose IV over 1 to 3 minutes. Recheck the sugars again. If the sugars are coming up, if the patient is gaining consciousness, you can give direct carbohydrate, and then when the patient is fully alert, maybe give the meal which is due for that time of the day. Why is preventing this hypoglycemia so important? Because the effects of hypoglycemia last between 48 hours to 7 days. So it's not only that time when the sugars are dropping, but the effects are seen in the cardiovascular system, affecting the endothelial dysfunction, the inflammatory markers, even after 7 days. So we need to prevent these hypoglycemic episodes. And how can we prevent this? Is by educating. Educating the patient is the most important thing. Advise about diet and exercise. If the patient is going exercising, empty stomach, ask them to have something before exercising. Cut down the insulin dosages if there are frequent hypoglycemias. Ask the patient to regularly monitor sugars. Relax the A1C targets if the patient's sugars are fluctuating a lot. And advise the patient and the caregiver to eat on time, to take their medications on time to prevent hypoglycemia. So hypoglycemia is something which can be preventable, it can be taken care of if the patient is educated well about, and there have been studies and awareness programs which have shown that good education about hypoglycemia and awareness about hypoglycemia can reduce the frequency and episodes of hypoglycemia. I end here by saying that we can help our patients to being in good glycemic control by educating them about good glycemic control, how to keep their sugars in range and prevent hypoglycemia. Thank you.